Hello, I'm Maggie Woodhouse. I'm an optometrist in Cardiff University, and I've had an interest for over 35 years in visual development in children with Down syndrome. That's both clinically and from a point of view of research. So you'd actually think I'd know it all by now, wouldn't you? But in fact, in any form of research, when we answer one question, it throws up lots more questions. So it's a continual journey, and there's lots of things that we don't know yet about vision in children with Down syndrome, and we'll actually talk about some of those as we go through this. Nicola has asked me to talk to parents of very young babies with Down syndrome about how vision develops. So let's start by talking about eyes and vision in typical babies. When babies are born, their vision is very poor. They see very little detail. They see in black and white rather than colour, and they see in 2 dimensions, not 3. Colour vision starts to develop at about 3 months, and as far as we know, red is the first colour that babies can actually appreciate. And that's why red is a really attractive colour to babies, and why babies' toys usually have red in them. Colour vision is complete by 6 to 12 months, so it appears and develops really rapidly in babies. 3D vision starts at about 4 months, again develops very rapidly, so that by the time babies are a year old, they're seeing in full colour and in complete 3D as well. Now, no one has studied how colour vision and 3D vision develop in children with Down syndrome. That's one of the things we don't know. But we have every reason to believe that it develops in the same way. If we measure detail vision in tiny babies, that's the same sort of vision we're measuring when we ask you to read a letter chart, although of course for babies we don't use letter charts. We have other ways of measuring vision very precisely that work very successfully with babies immediately after birth even. So if we do that, we find that babies with Down syndrome have vision that's the same as typical children from the word go. So that's why we suspect that colour vision and 3D is also developing in the same way. Detail vision goes on developing for much longer, and it may be about 4 to 6 years of age before children start to see in as much detail as they will as an adult. Actually, it turns out that children and adults with Down syndrome don't see the same level of detail as typical people do. But let's not worry about that for the moment. That's something to be very aware of when your child is older. But at the moment, we're just talking about very little ones. So your very tiny baby is seeing the world, as far as we know, in exactly the same way as a typical baby will. One of the things we know is that tiny babies love faces. You will know that anyway because your baby loves looking at you. And children with Down syndrome have the same interest in faces as do typical children, and in fact probably even more so. And this can present me with something of a challenge, because when I'm testing very little children with Down syndrome and I want them to look at something it's actually quite difficult to persuade a baby with Down syndrome to stop looking at me and look at whatever it is I'm showing them. When babies are very tiny, they don't have very good control of their eye movements. And one eye drifting in for a very short time is very common among all babies. Let me show you what I mean. That's my party piece. And you may see that quite frequently in a very young baby with or without Down syndrome. That's because the children lack the good control of their precise eye movements to keep both eyes together. So they grow out of that. So for most children, those baby squints disappear by about 4 months of age. Now, another thing we don't know about Down syndrome is whether babies with Down syndrome take a bit longer to do that, and that may be the case. So let's say 6 months for a baby with Down syndrome. So if your very little one has what appears to you to be a wandering eye, it can be either eye, don't worry about it. But if it persists beyond, let's say, 6 months, or if it's a permanent thing that one eye's always or most of the time in, rather than just being a very brief temporary thing, then that will need to get checked out. So have a word with your paediatrician and ask for a referral to the hospital eye clinic. All children are at risk of a squint. It's a bit more common in children with Down syndrome than it is in typical children, but the usual sort of squint we see doesn't appear until children are 2 years old, maybe between 2 and 3. So that's something to keep a lookout for when your little one is older. That too will require investigation at your hospital eye clinic or at your local optometrist. Now, there's nothing that can go wrong with a baby with Down syndrome's eyes that doesn't happen to typical children. It's like everything else you've been told to look out for in your child. All of these conditions do occur in the general population, but babies and little children with Down syndrome are at higher risk of a number of conditions. And we in the support business are very aware of all this doom and gloom you get when you first have a diagnosis. But one of the things I want to mention is nystagmus, which is a continual